I was perfectly happy to get my double jab. I think, millions of people were. We've seen incredible take up in this country without any force at all, other than being required to be double jabbed to come back in the country and not face a quarantine for a lot of the time, and obviously for travelling abroad. But the idea that we would need to have a booster jab, all of us at some point, it would appear, to be able to be considered fully jabbed, is that a step too far?
No, I agree. I think it is. So I've also been double jabbed, Julia, and I've currently, well, last week had COVID. So as well as having the kind of two vaccines, I've been my body's kind of my own immune system's now trying to fight off the virus and get rid of it. So the thought of me wanting to go and then have a booster jab, and my partner's actually had a booster because she works in the NHS. She's caught COVID, similar kind of symptoms to me, very mild and the like. So we've never in the past, when for the likes of the flu, we have annual vaccines for the vulnerable people, Julia. We've never mandated that everybody needs to have a flu vaccine. And as you rightly said, we've had a huge take up of the vaccine rollout. We've got significant numbers in the population. What this would mean actually is that about nearly 35 million people who have had two doses of the vaccine would suddenly become kind of unvaccinated if they change the definition. Now, we can't kind of argue with what other countries want to do. If a foreign country wants to say you need to have three jabs to come in, well, we've got a choice not to do that. But I think it's going one step too far in this country. Now, what we can see from the data is that we do see some kind of the immunity waning, especially among those who had the vaccine quite early. And I think if you're in the vulnerable groups, having a choice of a third vaccine, of course, that's is right for them. But mandating that everybody should have a booster, I think, is going that step too
Well,
far.
that's it. Everyone I know over 70s, my parents and aunts, things absolutely, couldn't wait to get their boosters. My in-laws had COVID 2 weeks after having had their booster, and I mean, barely a symptom between them at all. I'm delighted with it, and realistic that could have also happened after just the two jabs. Could also happen without being jabbed at all. I know plenty of people who've had it with barely a symptom at all. But given that they're in their 70s, great news. They've got that extra protection. But you've been looking at some of the data, which what you did at the Office for National Statistics, or in terms of health, and in terms of there is no doubt at all. You say the waning, particularly of AstraZeneca, and Pfizer, the two jabs we've most had in this country and the most vulnerable. The waning has been largely on your ability to catch COVID, not necessarily waning on your chances of getting seriously ill, being hospitalised or dying. That immunity is still lasting very well, isn't it? Dame Sarah Gilbert, who came up with the AstraZeneca vaccine, has said that she doesn't understand why boosters would even be needed, because the most important aspect of the jabs, what they were designed to do to prevent people dying, that actually still works just as well.
Yeah, well, if you look at the data, that is clearly the case, Julia. We've seen a significant number of reduction in deaths. There's going to be the vaccine effect. Also, remember now we've had millions of people across the country who've caught COVID as well. So there's that kind of, you could say that's the top up of immunity in the population on top of the vaccine, and it's quite clear that vaccines don't stop you catching the virus. I think that the concern for me, not just with kind of the vaccine policy, we talk about the NHS staff needing to have the vaccine and care home staff as well. Is that studies across the world have proven now, and even the ONS in our country is showing that people who've had COVID have got kind of a similar kind of reduction in the chances of catching it, which obviously will lead to lower hospitalizations and deaths, as people who are double vaccinated as well. So we're kind of ignoring that across the country in terms of our policy to tackling COVID. It seems to be that the immune system and the natural immunity has been forgotten, and the vaccines were a game changer this time last year when they started coming on. I think it wasn't long after now where we started getting the first people jabbed. But we've seen a significant reduction in people in hospital. I think the concern, Julia, and you could hear it yesterday from Chris Whitty, is that the NHS is under a lot of pressure, and we do know that the number of patients in hospital at the moment is 40% lower than this time last year. The big problem, obviously, Julia, is that we've got a lot of patients in the NHS because of the catch-up of COVID as well.
But the big fear, hasn't it, has been that we're going to get another big wave now. We're just on an uptick now, having gone down for 16 days. So again, which media for some reason didn't notice at any point. They're still claiming it was going up when it was going down. We've got hospitalizations and deaths, which are a lag from when it was going down, still going down right now. We're still at a relatively high level, certainly, of cases compared to many other countries. But again, most of those cases were in much younger people who are very, very low risk, and in a largely vaccinated population. So not actually such a big concern. But the big worry people have is this idea that this is it forever now. There's going to be this effect of this mandate. You know, I've had to have a yellow fever jab to get into Peru before. I wasn't so concerned morally and ethically about having to have a jab to be allowed into another country, to be able to not quarantine that country. What France or any other America, what they choose to do is up to them. That they're in charge of that. But when it's my own country, when they're going to impose quarantine on me because I've not taken a third jab, even though I've had COVID and I've had 2 jabs and I'm perfectly healthy, then that's a different matter altogether. And there are a lot of people I know who are very happy to go and get their double jab, really happy to obey by the rules, do the right thing. And now they're like, this is going a step too far.
No, indeed, Julia, and I think that the big problem we're going to have here as well, because ultimately it all comes down to choice, and you might even find there may be some people in their 30s who want to have the booster jab and they can't because they've basically said you can only be over 40. So I think, you know, the vast swathes of the population have had 2 jabs. We've got to let the kind of ultimately I think if the virus was stopped transmission with the vaccine, that's a bit of a different story here. But we clearly know that the vaccine doesn't stop transmission. It may help reduce it, but it doesn't stop it completely. And that's the game changer, really. If it doesn't do that, ultimately, we're just going to live in a world now, Julia, where everybody in the population will catch COVID at some point in time. And for many people, the good news, I suppose, through all this pandemic has been, for many people, this is a very mild virus. We know that when we had the Spanish flu, it was killing a lot of young people 100 years ago. This is a virus that's not doing that, and just pushing vaccines across the whole population. I'm in the same camp as you. You know, I'm double jabbed. Caught COVID, you know, I don't see the necessary need to, especially at this stage, to go and have a booster vaccine. And if they start changing the definition, and I live in Wales where we've got these vaccine passes in at the moment, you know, if Mark Drakeford decides to jump on this bandwagon and start saying that you can't go into a venue unless you had 3 jabs, you know, when does this end?
Yeah, exactly. And again, will it be 4? Will it be 5? Will it be 6? Will it be 7? I mean, that's the thing. I'm perfectly happy for them to be available and for people who are in need of them to get them. I'm not anti-vax at all. But there should never be any coercion or threat or blackmail involved whatsoever in people getting health treatment. It's just morally wrong.